American Heart Association has even defined the amount of exercise that's necessary daily from a cardiovascular perspective to reduce long-term risk of heart attack, etc. And I was surprised in my own world to find out that it's sometimes 30 minutes a day of cardiovascular or aerobic exercise is really necessary to reduce long-term risk. We're all human. Not everybody can do that. What I tell people is as long as you're doing something, and I tend to encourage them to do it daily, that little something can grow like a seed. And pretty soon you become so accustomed to it that if you miss your exercise, even if it's 10 to 15 minutes, you have a different day than if you had exercised. And that type of training of my patients, what I encourage them to do, is very valuable. I've also become an advocate for, believe it or not, yoga in the setting of some of my patients with atrial fibrillation. I was very surprised to review the data on the advantages in some cases of atrial fibrillation patients of actually performing yoga. So lately I've been handing out information to my atrial fibrillation patients about relaxation techniques, deep breathing, and participating in activities that can help them have a moment of quiet in our hectic lifestyles without the BlackBerry or the iPhone ringing at you, to sit down and really have some time where you can relax and where you can train your body that it's okay to have a slow heart rate. It's okay to have that energy, quiet down for a little while before you head out back to your busy day.
Sometimes there's a challenge to find a time in your schedule for that full hour of day of going to the gym, and many people feel overwhelmed with that, and maybe even feel like there's no point in exercising if they're not able to achieve that goal. There are many things we can do in our daily lives just to increase our fitness level. Not driving around the parking lot waiting for the closest parking space, parking a little further away just adds a few steps to every day. Taking the stairs up or down instead of riding the elevator is another thing that we can do. And even if you have a 30-minute lunch break and it takes you 20 minutes to eat, well, just go on a walk through the corridors of the, of the office building or around outside wherever you live. Getting physical activity, even in small spurts, is just as good for your body as, a sustained exercise over a period of time.
I think the American Heart Association has clearly defined what really will help you in terms of activity levels. And that's what we try to tell patients, is these are the guidelines. This is where the evidence is. And even though it feels good to do a little bit, you kind of have to keep going. On watching the television sports shows, I was watching about Hank Aaron this morning. He kind of had to keep going to break Babe Ruth's record. He didn't stop at 500 home runs. And I think for all of us in our own ways, we kind of have to break our own records and say, we can do better.